going to tell you that how you are going to assess a patient of pediatric Genu Valgum. So for the examination of pediatric Genu Valgum, we have to keep 6 points in our mind. Number 1 is gait of the patient. Second point is intermalleolar distance. Third is femoral anteversion. Fourth point is tibial torsion. Fifth is metatarsus adductus. And sixth, most important point is whether we have to check deformity is in the femur or in tibia, which is going to help in our surgical correction. So we'll take one by one that how we are going to examine and how we will assess these patients. Number 1, while examining the gait of the patient, when see the patient gait while in the standing positions, we'll see the outer deviations of the leg from the knee joint, and patient is having wide best gait. Second point is we have to check the intermalleolar distance. For that, we ask the patient to lie down in the supine position and touching both the knee joint, and patella should be facing upward. So in distance between the two mid malleoli we have to check, and generally in this rule of 3 we have to follow that less than 3 years the distance between two malleolus will be less than 3 centimeters. Now third point, we have to check the femoral anteversion. In that we have to ask the patient to lie down in prone position, and knee should be bent at 90-degree angle, and just check the internal rotation of the thigh, and normal femoral anteversion is 10 to 15 degree, but in the cases of excess femoral anteversions the internal rotation will be more and the lateral border of the foot is touching to the side of the bed. Then how we are going to check the tibial torsion? We ask the patient to lie down in prone positions and flex the knee to the 90 degree and check for the thigh and foot angle. Normally thigh and foot angle will be in between 10 to 15 degree, but in the cases of tibial torsions it is more than 15 degree. Now we have to check the another point, metatarsus adductus. Generally metatarsus adductus, how we can assess? In the normal foot, the line bisecting the ankle, it should be coming in the first valve space, but in the cases of metatarsus adductus is going away from the first or second valve space. So that line we have to draw and check whether the patient is having metatarsus adductus or not. And the last point is whether we have to check deformity is in the tibia or the femur. For that we need to check the lateral distal femoral angle and medial proximal tibial angle. Normally it's 87 degree. If it's getting any change, it is more than 87 or less than 87 degree, then it either deformity is in the femur or in the tibia. So this is helping the planning of the surgical correction. Thank you.